Hello everyone. Uh, Welcome back to the Clear Aligner certification course. In today's lecture, we will be discussing one of the important concepts in clear aligner therapy, that is the biomechanics of aligners. Understanding biomechanics helps us answer a fundamental question: how does a thin plastic aligner actually move a tooth? So the answer involves the interaction between the aligners and the tooth and the periodontal ligament, the supporting bone attachments and planned sequence of tooth movement. Predictable aligner treatment requires not only a good digital setup but also an understanding of how orthodontic forces are generated and controlled. So the basic principle of tooth movement is that the orthodontic tooth movement occurs when a controlled force is applied to the tooth, and this force is transmitted through the periodontal ligament to the surrounding alveolar bone, producing a biological response that allows the tooth to move. So the same biological principle applies to clear aligner as to fixed appliance. The difference is uh, in how the force is delivered. When the fixed appliance brackets and wires provide the force system, with aligners, the elastic deformation of the thermoplastic material generates force when the aligner attempts to return to its programmed shape. Therefore, the aligner is essentially a three-dimensional force delivery system. How exactly does the aligner generate the force? So when the aligner is fabricated according to the planned position of the teeth, it does not initially fit perfectly when placed over the patient's current dentition. So the difference between the current tooth position and the programmed aligner position creates a mismatch. And when the patient inserts aligner, the plastic deforms to adapt to the teeth, and as the material attempts to return towards its original shape, it produces force on the teeth. So these forces can be used to produce tipping, rotation, translation, intrusion, extrusion, and torque. However, the magnitude and the direction of these forces depend upon the material properties and aligner thickness, geometry, tooth anatomy, attachment, and the amount of program movement that has been built into the aligner. Now, one of the most important concepts in orthodontic biomechanics is the relationship between force and moment. The force applied away from the center of resistance can create a moment that causes a tooth to rotate. That is, a rotational tendency develops. So, for example, if an aligner applies a force to the crown of the tooth without adequate root control, then the tooth may tip rather than more bodily movement. So this is one reason why complex movements can be challenging with aligners. So the orthodontist must therefore control not only the magnitude of force but also its direction and the point of application. Understanding the center of resistance. The center of resistance is an important biomechanical reference point for a tooth surrounded by a periodontal support. The center of resistance is located approximately within the middle third of the root, although its exact position varies with the root morphology and periodontal support. So, if the line of force passes through the center of resistance, the tooth tends to translate more effectively. So, the force is applied away from this point, a movement is generated according to the rotation or tipping. So, this explains why bodily movement and root control requires a more sophisticated force system. And let us now discuss the major tooth movement, that is the tipping. Tipping occurs when the crown moves more than the root. So aligners can produce tipping relatively well because the force are often applied to the crown. However, uncontrolled tipping may occur if adequate root control is not incorporated into the treatment plan. So in the bodily movement, the crown and the root move in approximately the same direction, and this requires a controlled combination of the movements, and attachment can improve the aligner's ability to generate this type of movement. So rotation is something which involves turning the tooth around the long axis. So the rotation of round teeth, particularly canine and premolar, can be challenging because the aligners may slip away from the tooth surface. So this is why approximately attachments are frequently used to improve rotational control. Intrusion moves the tooth apically into the surrounding tissue because the aligners can contact the incisal or occlusal surfaces. It can generate useful intrusive forces. However, the force must be carefully controlled and distributed over across the dentation. Extrusion is often more difficult with aligners because the aligners must effectively pull the tooth rather than simply push against it. An attachment and appropriate staging can move extrusion predictably. And now, torque refers to the controlled movement of the root relatively relative to the crown, and it is one of the most demanding movements for aligners because the force must be generate an appropriate moment. So, adequate attachment design, aligner engagement, and careful stagings are important for successful torque expression. The role of attachments in biomechanics. Of course, attachments are extremely important in aligner biomechanics. They act like handles that allow the aligners to engage the tooth more effectively depending upon their design and orientation. Attachments can improve retention, rotation, extrusion, root control, translation, and torque. So the important point is that the attachment should not simply be added anywhere. They should be selected according to the specific biomechanical requirement of the movement and i- important importance of staging. The clear aligner treatment is usually divided into sequence of small movements rather than attempting to move every tooth to its final position simultaneously. This process is called staging. For example, instead of attempting a large rotation in one step, the movement may be divided across several aligners, and staging helps force within a uh, more manageable range and allows different teeth to act as a anchorage while others move. So, poor staging can lead to excessive force, poor tracking, and increased refinement. Anchorage in clear aligners. Anchorage in the is the ability to assist unwanted tooth movement. So, while the other teeth are being moved, for example, when closing an extraction space or moving anterior teeth, posterior teeth may be required to provide anchorage, and aligners can distribute force across multiple teeth, allowing the clinician to use the entire dentition as an anchorage unit. So, attachment um, optimized staging elastics and appropriate aligner designs can further improve anchorage control. Uh, Biomechanics of aligners are also influenced by the material itself. Important factors include the material stiffness, thickness, elasticity, stress relaxation, water absorption, temperature, and duration of wear. And as the aligner is worn, the material may undergo changes